Besser, who I mentioned is a pediatrician, will also provide an overall perspective on vaccines and what decreased vaccine uptake might mean for American families at large, especially in vulnerable communities. So with that, please join me in welcoming Dr. Besser, who will speak for 10 minutes, immediately followed by lots of time for your questions. We have received over a dozen questions via email. We'll prioritize those, but please feel free to enter questions in the chat, and we'll aim to get as many responses as we can. So thank you so much for joining us, Dr. Besser, and we really appreciate the time that you are taking to support community journalism. And this, as you can see, is community journalism at its best. Welcome.
Well, thank you so much for having me here today. I probably won't use a full 10 minutes because I do want to make sure that I get to as many questions that you have as possible. Thank you for what you do. Journalism has never been more important than it is today, when just the concept of a shared set of facts is being contested around the country. I am Dr. Rich Besser. I'm president and CEO of the Robert Wood Johnson Foundation. I've been in this role for almost 9 years. As you heard, I am a pediatrician, and I practiced general pediatrics for more than 30 years. All the time that I've been working in public health, I've also been a pediatrician working in federally qualified health centers, so community clinics. The time I spent at the Centers for Disease Control and Prevention, I started as a disease detective. I worked for many years as an epidemiologist. And at the end of my career there, I ran emergency preparedness and response for 4 years, and then was the acting director at the start of the swine flu pandemic in 2009. The foundation that I now lead is focused on a future in America where health is no longer a privilege for some, it's a right for all. And that's a bold vision. We are nowhere near seeing that vision be a reality in America. And I have grave concerns that over the past year, we've been moving in the wrong direction. And part of that is tied to vaccines and what we're talking about today. But more fundamentally, we see an administration that no longer sees the role of government as providing the opportunity for health for all. And so we're seeing access to healthcare more broadly be limited. At the end of this year, millions of people who've had access to Medicaid will be losing that access. And it's very hard to live your healthiest life if you don't have access to high quality, comprehensive, affordable healthcare. But the topic that we're focusing on today is vaccines. And during my 30 plus years of pediatrics, I can say without a doubt, there was nothing that I did that had more proven value in terms of protecting and maintaining the health of my patients than helping to ensure that they were vaccinated fully and on time. And that involved developing relationships with parents, being open to hearing concerns and questions and addressing those questions. And it was a lot easier than the times we're in now. A lot of mistrust in healthcare, in public health, developed during the response to the COVID pandemic. And it's hard for me to see the path towards restoring the trust that was damaged. But in that exam room with a child and a mom or a dad or a grandparent, whoever was providing care, that was a setting where there was trust and needs to be trust, so that a parent can ask their questions about the safety of a vaccine, why it's being given at a certain age, so that there can be a level of comfort. The challenge now is that we have, as our Secretary of Health, one of the nation's leading anti-vaccine advocates. Secretary Kennedy, before he was Secretary of Health, he founded one of the organizations that is really challenging the concept that vaccines are safe and effective. It flies in the face of science. It flies in the face of fact. But having someone in that critical role has damaged people's trust in vaccination in ways that we're seeing play out around the country. You can see in South Carolina the massive measles outbreak that's taking place. We saw it start last year in Texas, but it's not limited to those states. Viruses don't respect the borders of states. They don't care what political party you align yourself with. If you are not vaccinated, or if the vaccine happened to not work for you, measles will find you and measles will infect you. It is a really good marker for how well or poorly a community or a country is vaccinating. And the meeting that was canceled for next week is the meeting of the Advisory Committee on Immunization Practices. That committee has played a very important role in public health in America. Typically that committee has been made up with some of the nation's leading experts in infectious diseases, in vaccines, in population health, in issues of health disparity and health equity. And they have reviewed the scientific evidence around each vaccine and have made recommendations. And when I was practicing pediatrics, I would look to see each year what the CDC recommended in terms of flu vaccine, in terms of COVID vaccines, in terms of the basic vaccines for children. And it is absolutely heartbreaking to me, having worked at the CDC for 13 years with dedicated employees, to have to say, I do not recommend looking to the CDC for information around vaccines. The committee that was there was disbanded by the secretary, and the current committee is loaded with anti-vaccine zealots. Not every person, but for someone to come onto that committee who has no expertise in vaccines and public health, in how to understand the science of these infectious diseases, does not put them in a position to be able to provide the recommendations for the nation. So what we're seeing are other bodies step up. The American Academy of Pediatrics, I'm a member of that organization. They put out recommendations. They used to be the almost identical recommendations to the CDC. They're not anymore, but I recommend that doctors follow those recommendations. Parents who want to know more about vaccines, vaccine safety and effectiveness, should look to the Academy of Pediatrics for that kind of information. I would not recommend looking at the CDC website. It is now full of misinformation and disinformation. The meeting was canceled for next week. It's not exactly clear why. The Academy of Pediatrics and other medical organizations filed a lawsuit against the federal government, saying that the guidance that had been put out by the ACIP was illegitimate guidance. It wasn't based on the best evidence. We filed an amicus brief to support that lawsuit, as did a number of others. And part of that lawsuit was calling on the meeting for next week to be canceled. They didn't attribute the cancellation to that lawsuit. It may have more to do with the political climate, where people in both parties overwhelmingly believe that vaccination is the best way to protect the health of our communities. I think it probably has more to do with that and the political climate that we're in. But I think it is a good thing that the meeting was put on hold, because the meetings over the past year have done incredible harm to the health of our nation. Why don't I stop there? I could keep going. I said I wasn't going to use 10 minutes, and then I think I probably did. But I'd love to hear the questions that you have, and we can take it in any direction that you'd like to go.
Well, thank you for that. As start off, we have, as I said, a number of questions that came in via email. I'm going to start with a couple of questions. Dr. Besser, what do you say to parents who are simply unsure of what to believe right now?
Yeah, what I say is I don't recommend taking your medical advice from politicians. Um, my advice is if you're fortunate enough to have a medical provider who you know and trust, ask them. Ask them what you should do. It's really challenging to sort out through all the noise that's going on. One of the challenges, however, though, is that not everybody has a doctor. And the number of people who have a doctor is actually declining. So we're going to see issues of health disparities based on that and that alone. What the ACIP did was it moved a number of vaccines from a category of being recommended for all children to a category that they call shared decision making. I find that strange because every decision I made with a family was shared decision making.
Right.
I think that's at the start. Everyone should feel that their health is something that they have control over, and any decision with a healthcare provider should involve shared decision making. But talk to your doctor or your child's doctor, your nurse, your pharmacist, someone who you know and you trust, who is not tied up in the political noise that's going on. And you have a right to have your questions answered. And so if someone is saying that you should just do X, Y, or Z and doesn't want to answer your questions, I wouldn't view that as a very trustworthy provider.
Thank you. You addressed this briefly. Did the COVID-19 pandemic give rise to overall vaccine skepticism, as so many people dutifully took their shots but got COVID nonetheless? And many people saw their parents die even after taking the shot.
Well, it's challenging. There were a lot of challenges with COVID-19. I ran, as I said at the top, I ran emergency preparedness and response at CDC for 4 years, and at the start of the swine flu pandemic. And during that pandemic, we had a very aggressive communication approach. So, we made sure that the public heard directly from us at CDC multiple times a day. And we shared what we knew, what we didn't know, and what we were doing to get answers. And we said up front that many of the things that we recommend today, based on expert opinion, will change as we learn more. And so changing recommendations are a good thing. It means that we're learning and that we can provide better recommendations so that people can make more informed decisions about their health. During COVID-19, CDC was shut off from the public. They weren't allowed to talk directly. And so you had politicians framing every new recommendation as a flip-flop, but it was framed as public health doesn't know what they're doing. And as with any new public health crisis, many of the things that you thought at the beginning will change, and your recommendations will change with that. There was no opportunity to bring the public along and maintain trust during that pandemic. I also think that one of the challenges with vaccines is that they impact your risk of getting a disease. And so, with the COVID vaccine, if you get the vaccine, you were far less likely to get severe COVID, to be hospitalized, or to die than if you didn't get the vaccine. But that doesn't mean that there weren't people who got the vaccine, who got sick, who got hospitalized and died. It was just a smaller percentage. So the measles vaccine is probably one of the best vaccines we have. It's about 95% effective. That still means that 5% of people who get that vaccine could still get measles. And that's really, really challenging, especially in a pandemic situation where it whips through an entire community. If that vaccine was the mRNA vaccines were very effective and very safe. They were over 80% effective. But that means if 100 people got that vaccine, 20 people are still going to get COVID. And so that's a real challenge because it's the people who got the disease after a vaccine are going to be much more vocal about it than someone who got a vaccine and didn't get the disease. It's a real challenge in public health. It's one where I think journalists can play a role in trying to explain that challenging concept. It's one of the biggest problems with public health is when it's working really effectively, it's invisible. It's when these systems aren't there that you start to see, people getting sick at a restaurant because it was never inspected, or people getting sick at a swimming pool because the water wasn't being monitored. But you don't hear about public health when people go to the pool and they don't get sick, or you go out for dinner and you don't get food poisoning, because those things shouldn't happen. So it's a real challenge for to maintain the investment in these systems that protect the community as a whole.
Thank you. I have a few more questions, but let's start with questions from reporters. Henrietta Burrows of East Palo Alto Today, please ask your question.
Thanks so much, Sunita. Dr. Besser, when you consider that the public's trust in vaccines is declining, and communicable diseases like measles, which had been under control, are increasing, what can be done to regain the public's trust again? Will it take diseases like measles to continue to get out of control for the public to believe in vaccines again?
And that's a great question. Unfortunately, I think that it will. I think that until people are seeing in their community diseases that were not around at all during their lifetime, it's going to be very hard to get the support that we need. There are major efforts taking place around the country to remove the vaccination requirements for children going to school. To me, that is one of the most frightening ideas that I've seen in my lifetime. Because what it will mean is that if you're sending your child to kindergarten and you've decided to vaccinate, you don't know that they're not going to be sitting next to a child who is unvaccinated, who could potentially give them something quite serious and quite severe. As a global community, we have come very close to wiping polio off the face of the planet. The only disease that in humans that we have been successful at doing that for is smallpox. And there's a global effort to wipe out polio. That effort, I don't think is going to be successful. And I think one of the big reasons it's not going to be successful is that here in the United States, we are backing away from the commitment to ensuring that every child in every community has access to the vaccines that can help protect their health. It's a very sad situation, but it's very. If you're a parent who's never seen polio, doesn't really know much about what polio even is, and you have the person who is leading the advisory committee to the CDC saying, well, I don't think polio vaccine should be required. It should be a matter of choice. It can be really challenging as a parent to know, well, I don't even know what polio is. We don't have polio in America. Why should I even bother to give my child a vaccine that may make them fussy, give them a sore arm? I'm not going to go that route. But the idea that polio could come back to our country is just devastating. I visited a polio hospital in India and saw the outcome of what happens in communities that have not had the same access to vaccination. And it's debilitating. Each new vaccine that has protected our children, to me, was a miracle. And there were so many diseases that I saw when I was training as a pediatric resident in Baltimore, different types of meningitis that we just don't see anymore. But with the new vaccine recommendations from the ACIP, some of those diseases are going to be coming back.
Thank you. Orhan Akurt, editor of Zaman America, has the next question. Orhan, welcome.
Yes, thank you. Thank you for this opportunity. Yeah, my question is, some ACIP members who have described the single dose mRNA COVID-19 vaccine as a dangerous. So based on the current body evidence, how would you assess its safety and risk-benefit profile?
Yeah, you know, the mRNA vaccines, I would assess as extremely safe. You know, the mRNA vaccines, the development of that technology occurred over about 2 decades with federal dollars that were invested in universities around the country. And what we saw in 2020 with the arrival of the COVID pandemic, a new infectious agent, typically it would have taken 2 or 3 years to develop a safe and effective vaccine. Within about a year of this virus being identified, we had multiple safe and highly effective vaccines that were being made available in communities because of the investment in research and all the work that had been done to show that the technology worked and to see and make sure that it was safe. And that, because of that time, how short that time was, millions of lives were saved. This administration has decided that they are not going to support mRNA work, and the Secretary of Health canceled hundreds of millions of dollars in research. And this is research into approaches that could have provided new treatments for cancer, as well as approaches to infectious diseases. One of the beauties of the technology is how quickly you can use this approach to make vaccines against new diseases. And there was a lot of work going on to develop flu vaccines using mRNA technology. Because one of the challenges with the flu vaccine is that while I think people should get the vaccine, it's not as effective as a lot of vaccines, and you have to get it every year. So if you could come up with an approach to flu that was like measles, where you get one shot and you're good for the rest of your life, right, that would be an amazing thing in terms of protecting people's lives, reducing cost, and getting flu under control. But when you have an approach that says that the Secretary of Health has said that he's never seen what he would call a safe and effective vaccine, that's a very challenging situation.
Great. Hung Duan from Viet Bao News has the next question. Hung, welcome.
Hi, my name is Hung Duan. I'm working for Viet Bao News. You know that in Vietnamese community, we have a high percentage of getting hepatitis B vaccine. But now with the new guideline like this, is there any effect on the hepatitis vaccine?
Hung, you're kind of flipping out. Let me ask your question for you. The Vietnamese community has had a high percentage of getting hepatitis B vaccines. Could you discuss the effect of the Hep B vaccine for elderly Vietnamese people?
Hepatitis B vaccine?
Yes.
Yeah. So hepatitis B vaccine, to me, is I mean, you'll hear me use the phrase a lot, but I think it's pretty miraculous, because this is a vaccine that not only reduces hepatitis B infection, it reduces liver cancer and cirrhosis. It is an anti-cancer vaccine. And the reason for that is that one of the leading causes of liver cancer in adults is hepatitis B infection. Because for many people, when they get hepatitis B infection, it sets up shop in their body and becomes a chronic infection. It becomes an infection that the body can't clear. And that inflammation that takes place in the liver can destroy the liver and eventually cause the liver to become cancerous. The ACIP recently removed the recommendation that hepatitis B vaccine be given to newborns. And that is I think, a very unwise decision. The reason it's unwise is that we had tried this approach before of vaccinating children at an older age, and we were still seeing thousands of cases of hepatitis B in the United States every year. By vaccinating at the newborn period, we pretty much knocked out hepatitis B in America. And so I worry now that we are going to start to see a rise in hepatitis B, but we're not going to see it probably for decades. The reason is that the main reason we vaccinate against hepatitis B is to prevent the cancers that occur later in life. Now, your question was about hepatitis B for adults. It's worth having a conversation with your doctor because it depends on who the adult is. There may be many adults who've come here as immigrants from other countries who had hepatitis B infection when they were younger, who may now be immune and not need to get the vaccine. And there's a blood test that can be used there in those situations to see. But it is worth a conversation.
Thank you. We move on to Pamela Unchung from the Immigrant Magazine. Pamela, welcome. Please ask the second portion of your question.
Thank you so much, Dr. Besser. Like Sunita said, I should ask the second question. I'm from the Immigrant Magazine, and so my audience is it's immigrant and very culturally bound by their experiences and trust issues from their home countries. So what do you think? What should immigrant families understand about these updates, the confusion, and for undocumented folks, I'm just curious to know whether their families are safe when seeking vaccines, specifically if their personal information is protected, and is there any risk of data sharing with immigration enforcement?
Question.
Thank you for those questions. This is a really challenging area because what we've seen in terms of immigration enforcement by ICE around the country has reduced. It has created a barrier for immigrants to get the health care that they need and deserve. And because it's not an unfounded concern about the possibility that ICE could be at a medical facility. And so around the country, what we're hearing about is a decline in people showing up for visits that they've had because of the concerns about what ICE might be doing. So the idea that vaccines should be all this shared decision making, it's hard enough for a documented immigrant to get a healthcare provider who speaks the same language and is culturally attuned. The idea that someone who's undocumented can access those services and have a shared decision-making conversation defies logic. I think that for many families, vaccines are given through public health clinics. And so it's worth finding out what the practices are in the clinic in your community to know that it's safe. I think it is for many of these infections, it is dangerous to have a child who is unvaccinated. And so you have to look to see what is available in your particular community, who some of the trusted voices are that you can turn to find out what the practices are at a given clinic. My understanding is that the federally qualified health centers, the community clinics in America, have not been collecting or sharing immigration information. But that doesn't mean that information isn't being accessed in ways that are not lawful. I wish I had a more encouraging response to your question, because it is so important that everyone in our country has access to high quality healthcare.
And Pamela, it's important to note that in California, your immigration status is not required when you check into a hospital. Next up is Nestor Fantini from Hispanicus LA. Nestor, please go ahead and ask your question.
Shanita, just back to your last comment. It would be great if someone wanted to write an article looking at the collection of immigration information by state, so that people would have a sense of where it's safe, where it's not.
Right. I only know of California thus far, but yeah, you're right. It would be. Nestor, please go ahead.
Yes, thank you. Dr. Besser, during your tenure as acting director of the CDC, how often did political leaders attempt to influence the vaccine recommendations, and how does the current situation compare?
Well, I was only acting director for about 6 months, but I was at the agency for 13 years. And I was there during Republican and Democratic administrations. And I never saw an attempt by political appointees to influence the vaccine recommendations. The federal advisory committee system is designed to ensure that political influence is limited and constrained when it comes to the advice provided to the government. These are supposed to be independent bodies of experts who are providing information. It's a separate question in terms of, are the recommendations accepted? Because the recommendations of the committee are recommendations to the director of CDC, and then the CDC director can either accept or not those recommendations. During my time at CDC, I cannot recall a single instance where the CDC director did not accept the recommendations of the committee and see those go forward. But it is set up so that political appointee could do that. The 4 years I spent running emergency preparedness and response, I started on the day Katrina hit New Orleans. And then I transitioned to be acting director when President Obama was elected. There was never a concern that the approach to public health was going to change based on political party. This was something where the entire nation was unified around the importance of protecting our communities and the health through the public health approach. What we're seeing now was absolutely unthinkable.
Thank you. Here's Sui Sui Ai, editor of the Myanmar Gazette. Sui Sui, please ask your second question.
Thank you so much for sharing such important information about the vaccine update news to our community, Dr. Besser. My question is that given that 16% of patients are already skipping or delaying vaccines, how do controversial recommendations from this new ACIP panel affect public trust and the work of local healthcare providers? Thank you.
Thank you.
Thanks for that question. I think that this makes it much harder on healthcare providers around the country. As we all know, you don't get that many minutes in the exam room with your doctor, and the confusion that is swirling around vaccines and vaccine information is more than can be handled in a routine pediatric well child visit. You don't want to spend your whole visit talking about vaccines, something that was taken for granted, had been well studied, were safe, were effective. You want to talk about child development. You want to talk about nutrition. You want to talk about all the things that parents come in wanting to know about. And what I worry is that more and more parents are going to say, you know what, this is just too confusing for me. I think I'm just going to hold off for now. And when that happens, a lot of children end up falling behind and are not vaccinated against diseases that may do some real harm.
Absolutely. Next up is Araceli Martinez of La Opinion. Araceli, please go ahead with your question. Let's move on. Araceli, we move on to Mia Kim of Faith for News. Mia?
Hi, this is Mia Kim from Faith for News, based in Atlanta. Dr. Besser, do you believe the government has been fully transparent about both the benefit and potential risk of a vaccine? If not, what need to change?
Was that about the COVID vaccine or all vaccines?
I believe she meant all vaccines. Yes.
Yeah. The Secretary of Health talks about the importance of transparency. And yet, outside of an ACIP meeting, the department decided to take a whole series of vaccines and no longer recommend them routinely for children. What went into that decision, how the evidence was looked at or wasn't looked at, wasn't made clear. And so to me, that is a textbook picture of lack of transparency. It's very important that the process that's used to look at the effectiveness of a vaccine and the safety of a vaccine be totally transparent. And that's what I always found so comforting about the former ACIP. I would watch a lot of the hearings. They would always be streaming over the internet. You'd hear the discussion. I'm an epidemiologist as well as a pediatrician, and so I could look at the data and see whether I agreed with the presentation and the conclusions. And that left me feeling very, very comfortable in the recommendations that I would make to the families who were under my care. We're not seeing that anymore. When it comes to the COVID vaccine and the COVID vaccines, I talked earlier about how miraculous it was that we had so many vaccines that were safe and effective very quickly. What it's important to understand is that with any new medical treatment, whether it's a new medication or a vaccine or a medical device, the studies are done on thousands of people. However, there can be rare side effects from any of those things that you won't see until they're used in millions of people. And so, that was the case with some of the COVID vaccines, where there were some of the vaccines had side effects that you didn't see until they were in millions of people. That doesn't mean they're not safe, because safe is not a black or white issue. It's, what are the potential downsides from a vaccine? How frequently do they occur? Can you predict who they're going to occur in? What is the risk from being vaccinated? What's the risk of from being not vaccinated? That's all information that needs to be taken in. And so there's always a system put in place. It's called it's surveillance, but the word surveillance is not a great term because it's other ways. But it's systems to monitor the population so that clinicians can report any health effects that have occurred shortly after someone has received a vaccine, so they can be looked into to see whether they were caused by that vaccine. It's a challenging thing to explain and to explain quickly. And I think that public health professionals can do a better job at explaining that. The fact that there may be and likely will be with any medical treatment rare side effects that we don't see until it's used in millions of people. And that as those are identified, we'll share those with people so that they can continue to make informed decisions about what they want to do.
Thank you. Next up is Rebecca Bartis of America Nipsava. Rebecca, in the interest of time, could you please ask the latter half of your question?
Yes, thank you so much, Sunita, and thank you, Dr. Besser, for your time. How can journalists identify and seek sources that offer credible information against anti-vaccination campaigns?
Great.
Yeah, thanks for that. I think it is so important to develop sources and to stick with them. I think that you can identify providers through the various medical societies. So the American Academy of Pediatrics, the American Academy of Family Practice. If you go to their media contact sites, they can connect you to pediatricians, family practitioners, infectious disease experts who can give you information. Likewise, when it comes to public health, the American Public Health Association can connect you to voices who can speak to the science. You know, one of the reasons I do a lot of media interviews is that I think it's really important that journalists have access to honest, factual information as they're working on their stories.
Thank you. Jewei Liu from the World Journal LA has the next question.
Okay,
Jewei.
sure. I'll make it concise. So my question is more about the language access. So in your opinion, how might ACIP's recent recommendations affect trust in immigrant communities that rely on ethnic media and local doctors for vaccine information? And how can public health agencies ensure accurate outreach to non-English speaking populations?
Thank you.
Yeah. Thank you. That is a great question, and it's one where even before this administration came in with a very strong anti-vaccine agenda, the public health community has not done enough to ensure that everyone has access to factual information in their native language. I don't know the best sources. I think it depends on the languages that you're looking for. There clearly are more Spanish language materials available than there are others. But I don't have a good answer for that because I'm not sure what the wealth of information is. I know the Academy of Pediatrics, their general information on childhood development and nutrition and things are translated into many, many different languages. But I don't know with information that comes out quickly, recommendations from committees, changing information, how that is. I think that journalists play a really important role. And one of the reasons we at the RWJF are supporting a more diverse media landscape is to help ensure that people have information that is culturally appropriate and in the language where people can take it in.
Thank you. Ling Huang from Sinovision has the next question. Ling?
Hi, thank you, Sunita and Dr. Besser. This is Ling Huang from Sinovision. My question is that how should our communities and health leaders respond to the rising vaccine preventable disease, such as measles, especially for the parents with young kids? Thank you.
Thank you. You know, one of the things that we saw with COVID, and that I hope the public health community would learn, was that it's really important that people hear information from sources who they trust, and that's going to vary by community. I was on the governor's commission here in New Jersey, providing advice. And what we saw here in New Jersey was that as public health learned how to engage within communities, with community leaders, and worked to provide vaccine in churches and community centers and places where people congregated, and they provided opportunities for local trusted voices to speak out, they saw the rates of vaccination go up. And they saw lives being saved. It's critically important that community leaders speak out on these issues, speak out against the false information that's being spread by our government, and say this isn't true. It's very important that we protect our children from these diseases, because there's nothing more tragic than a child getting a disease that could have been prevented by a simple shot.
Elena Kuzitnova from Slavik SAC has a question. Elena, welcome.
Thank you, Sunita. So, Dr. Besser, I have quite a broad question to you. How lower vaccination rates following those controversial recommendations of CDC and some politicians may affect the cost of medical coverage, may affect the funding of medical and scientific research, and potentially change the US position as a global leader, and affect quality of life and life expectancy of the average American citizen, if you have such data or projections? Thank you.
Yeah, I can't give you numbers, but I can tell you what we're seeing. The U.S. is losing its position as the world's leader in biomedical research, and we're seeing that because the NIH is backing away from funding a lot of critical biomedical research. We are seeing the U.S. lose its position in terms of global health diplomacy. The U.S. used to spend a lot of resources through USAID to help support other countries around the world in immunization, as well as many other health initiatives. So I think the U.S. is giving up an important diplomatic tool, as well as giving up its ethical responsibility as a member of the global community. There's a myth that people in the U.S. live longer than other nations. The U.S. is not in the top 10 when it comes to life expectancy, and there's all kinds of reasons for that. We are the only wealthy nation in which not everyone has access to healthcare. Your ability to see a doctor in the United States depends on your ability to pay, and that's not the case in other wealthy nations. So if you have a lot of resources, you do pretty well in the United States. Your life expectancy is very high. But just as an example, I lived in Princeton, New Jersey. The life expectancy for a baby born in Princeton, New Jersey was 87 years at birth, very high. I worked for 7 years in a clinic in Trenton, New Jersey, which was 14 miles away. It's in the same county, Mercer County. Life expectancy for a baby born near that clinic was 73 years. So 14 miles, 14 years. So, it's really important that we lift up this kind of information. We've funded a lot of research that can let you look at life expectancy by census tract in the United States. If you go on Google and you Google that, life expectancy by census tract, you will get a website where you can put in an address and they will tell you the life expectancy at birth. And there's a lot of good stories that you can do comparing neighborhoods that are side by side, or comparing neighborhoods that are on a subway line, and look how life expectancy varies by neighborhood, by conditions within our country. I think what we're seeing here now with this government is going to worsen those kinds of effects.
Just to piggyback off of Elena's question, on January 26th, we pulled out of the World Health Organization. Dr. Besser, could you talk about the impact to Americans for, as the U.S. pulls out?
Yeah, it's just so sad. The World Health Organization, part of the United Nations, is a body that is committed to global health, to ensuring that health is a right for everyone on the planet. And the U.S. played an important role there. There are reasons to be engaged in the World Health Organization out of pure self-interest. Infectious diseases do not respect borders. And most of the emerging pathogens that we've seen, the new emerging diseases, have arisen in places around the globe where animals, humans, and environment collide. And so by being part of the World Health Organization, we help protect people here by helping to control new diseases wherever they may spring up. I also believe to my core that there's a fundamental moral responsibility to be part of the global community as a wealthy nation, to share what we have and to help ensure that things like vaccines are available to everyone everywhere. And the US traditionally had been part of efforts to do that through the World Health Organization, through the Global Alliance for Vaccines Initiative, and other mechanisms. And pulling back from the World Health Organization will not make people in this country safer. It puts people here and around the world at increasing risk.
I'm going to ask a question from freelance writer Raji Lay. Are states stepping in here and creating their own mechanisms for being reliable sources for vaccine information?
Yeah, that's a great question, and thanks for that, because I should have mentioned it. We are seeing a lot of efforts at the state level to basically replace the CDC in the role of making vaccine recommendations. So there is a collective of states in the Pacific Northwest. There's a collective of states in the Northeast, in the South, and they are coming together and coming up with unified vaccine recommendations. You know, a challenge will be if the vaccine recommendations vary by region. Hopefully they'll all rely on the type of recommendations we're seeing coming out of the Academy of Pediatrics. But as a foundation, we're supporting a number of these efforts around the country to allow states to come together. And there's a wonderful project at the University of Minnesota called the Vaccine Integrity Project. And that project is doing the analysis, the kind of research and evidence gathering that the ACIP formerly was looked to. So as there's new studies and new information, it's important that the question is always asked, well, has something changed about this vaccine or about this disease that should change what the recommendations are? And having this body that is independent, that is scientifically based, will continue to provide the evidence that we need, so that as more information is learned, vaccine recommendations can be changed and continue to be as safe as possible.
Thank you. My colleague Peter Sherman has a question for you. Peter.
Hi, Dr. Besser. Thank you so much, Sunita. You know, I was curious about sort of the links between climate change and sort of emerging pathogens. There's been studies wondering if there are any strains that are emerging now that are cause for concern, and how prepared the country is. God forbid that there be another pandemic. I also, if I could ask another question, you know, Kennedy's focus on food has been really interesting to me, particularly. And I have found that for a long time, the science behind food, you know, ultra processed food, it was late to sort of come to that. And I think for me, it raises questions about the science and the motivations, particularly the monetary motivations behind science. And so I'm wondering what you have to say about that and how that relates to trust more broadly in our medical system. Thank you.
Thanks. I'll start with the food, and then I'll get back to the pandemics. You know, I think that the secretary is onto something important when it comes to food. You know, but I would love to see those efforts channeled in a slightly different way. We know the importance of having access to high quality, real food. You know, I remember having a conversation with a grandmother in clinic in New York where I was working, and I was going over it was the food plate at that time, and going over the number of servings of vegetables and fruits and things that were recommended, and then talking to her about where you know, what her children were eating, and she said, well, most nights we'll go to the fast food restaurant. And I said, well, you know, the food plate says, you know, you should be doing this, this, and this. And she says, I know what's on the food plate, but where am I going to be able to feed a family of four for something where I can afford and get that kind of food? It's just not available. And that's a challenge in this country. What I would love to see the secretary do is work with the Secretary of Agriculture and revamp the school lunch program. Over half of the children in America get their main meal from our school lunch program. But the amount of dollars that go into that are measly, you know, and the number of schools that have a kitchen that can prepare real food is dwindling. So put the money in to ensure that children can have a healthy lunch that's made of real food, food that you can identify, that isn't a number of chemicals on the side of a box. But just saying that people should eat less processed food doesn't speak to the reality of the fact that it's pretty hard with the economic conditions in our country to put a meal on the table for a family that is the type of meal that you want to put there. So you know, the identification of the problem is real, but I think the solutions for how you get broader access to real food needs a lot of work. You can't be talking about access to real food at the same time you're cutting the supplemental nutrition and assistance program that allow families to buy real food to feed their families. Oh, and the pandemic question. There will be another pandemic. That's a given. You can't say when that pandemic will be, and you can't say what it will be from. Will it be flu? I don't know. Will it be a new virus we haven't seen? I can't say that. But what I can say is we will be less prepared for the next pandemic than we were for COVID because of the decimation of CDC, the reduction of funding for state and local, tribal and territorial health departments, and the belief that this administration is putting forward that public health is not there for the public good. Those things will put us in great danger. And from the question before, if we're not part of the World Health Organization, we are in great trouble the next time a pandemic hits.
Absolutely. Before we let you go, Dr. Besser, one last question. Dr. Jay Bhattacharya was named as the acting director of the CDC in addition to his role at the NIH earlier this week. Could you comment on this move? Did it impact the scheduling of the ACIP meeting?
I don't know if it impacted the scheduling of the ACIP meeting, but I can tell you this. Running the CDC is more than a full-time job. Running the NIH is more than a full-time job. Putting someone in the position of running both of those reflects a lack of understanding of what these institutions are supposed to be doing. And I think that having someone as the acting director of CDC who has no experience in emergency public health response puts us in great danger the next time we have a public health crisis. The reason I was made the acting director at the start of the Obama administration, before there was a permanent director, was that I had run emergency preparedness and response at the agency for 4 years. And so if there was a crisis, they wanted to make sure there was someone in that chair who knew what they were doing. Thankfully, they did. They took that approach because while I was in the chair, we had the swine flu pandemic. I don't know what Dr. Bhattacharya would do if he's having to run the NIH and the CDC during a public health emergency.
Thank you. Dr. Besser and the RWJF team, thank you so much for joining us today. We so appreciate your support for community journalism. Reporters, please join us next Friday for